to demonstrate how the Discourse Virtual Patient Platform can be used to create key features examination cases. Key features cases were developed by Georges Bourdage at the University of Illinois and have been used for high-stakes examinations for physicians in both Canada and Australia for a number of years. The advantage of key features cases is that a number of clinical topics can be covered in a relatively reasonable amount of time by focusing on 2 or 3 key clinical features in each case, which test clinical judgment and reasoning, not strictly clinical knowledge. In this case, we have a 58-year-old male who has seen his primary care physician and has a lung mass on his chest x-ray. He has a history of COPD, a chest x-ray and CT scan have been ordered by the primary care physician, and they are available in the patient record to review. The chest x-ray shows a mass in the right chest, and the lateral film suggests that it is probably in the right middle lobe of the lung. The CT scan shows the mass as well and suggests that it is quite close to the pericardium and possibly to the chest wall. The first question the patient is asked is, what do you think the diagnosis is? And to answer this, they use an ICD-10 based system that Discourse developed, which allows them to start with neoplasms and work their way down to what they think the specific diagnosis is in this case. Question 2 asks the examinee what tests they would order if they were trying to evaluate the clinical stage of the tumor. The examinee is given a list of possible choices and selects as many as he or she wishes to select. The exams are all performed. Results are not given. In the last question, the examinee is asked what tests they would order to determine whether the patient has sufficient pulmonary reserve to tolerate the possibility of a bilobar resection, since imaging suggests that the right upper lobe may be involved as well. Again, the results show that the tests have been performed, but no results are given. The examinee then leaves the case by hitting the exit case button. The candidate score and areas of deductions are displayed